we are really excited to be represented here today and talking to this wonderful panel. And just by way of setting the tone for this panel, I'm going to go out there on a limb and say that heat might be one of the defining climate impacts of the 21st century. And I say that because it contributes to more deaths than most climate impacts, and that's true in the US and globally. And those impacts pervade almost every single sector. So you would be hard-pressed to find a sector or an agency that won't have to confront the challenge of rising temperatures now and in the future. And those consequences are largely avoidable, but they have not been avoided because we really lack a sophisticated and mature heat governance system at most levels of government. So I see that as a good thing. We have an opportunity space here in a moment. Governance is emerging quite rapidly, and we're actively in a position of crafting systems based on both local community perspectives, state actions, and federal programs. And so with that, I'd like to say we're very fortunate today to have several champions here on our panel, and I would like to take a moment to introduce them. And as a matter of housekeeping, we plan to have a couple questions, but devote a large portion of the conversation today to interactions with you all and taking your questions. So as our panel is introducing themselves and speaking, keep in mind questions that you might have for them. So first here to my left is John Balbus. He's currently the director of the new Office of Climate Change and Health Equity within the Office of the Assistant Secretary for Health and the Deputy Assistant of Secretary for Climate Change and Health Equity. He has over 25 years as a physician and a public health professional, and he's been with the federal government since 2009. Before serving his current role, he had a role as the Senior Advisor for Public Health to the Director of the National Institute of Environmental Health Sciences, and he is an expert at the health implications of climate change. So let's welcome John Balbus. Okay. Next, we have Dr. Eugene Livar, who is a pioneer in his role as the first chief heat officer at the state level here in Arizona. His role is to oversee Governor Hobbs' extreme heat preparedness plan. And he also has extensive experience, almost 20 years, over 20 years as an epidemiologist. He's previously served as the Office Chief of the Disease Integration Services, the Bureau Chief of Epidemiology and Disease Control, and as the Assistant Director of Public Health and Preparedness. Next, coming to us from Washington, we have Cunningham, who is the Senior Epidemiologist at Washington State Department of Health and manages the climate and health section there, with the goal to make communities healthier and more equitable as they achieve climate resilience. He has over 15 years of experience working in public health and has an MPH and MPA. He also has worked in over 4 countries, right? So 4 countries in public health, so brings both the state and international perspective. Welcome. And last, but certainly not least, we have David Hondula, who is the Director of Heat Response and Mitigation for the City of Phoenix, Arizona. He's held that role since October 2021, and he is the first publicly funded local heat, well, can we use the term chief heat officer, colloquially known as. He's responsible for coordinating the city's heat response plan and the tree and shade action plan, but also previously to that, and still, he is an academic here at Arizona State University with over 100 peer-reviewed research articles, and he is a colleague and co-author, and we're happy to have Dave here with us today. Okay, so with that, I'd like to dive in and we can start here and work our way down the panel. My first question is for you to introduce yourselves, your agency and its priorities pertaining to heat, and to tell us as succinctly as possible, why should governments at all levels prioritize investments in heat resilience?
Thanks so much, Kelly, and good morning, everybody. It is an honor to be on this panel and to be here speaking to the Western Governors Association, especially with this really great group of panelists. So our Office of Climate Change and Health Equity has a unique role within the federal government to be focused not just on the protection of people, especially those most vulnerable from the health impacts, but also we've taken on the role of focusing on the health system itself and the health sector and getting the health sector up to speed with respect to climate actions, both on the resilience side and because the health sector is 8.5% of the carbon footprint of the United States on the pollution reduction side and the decarbonization side. We focus on this across all of HHS, and a big part of what we try to do is to bring all of the resources of health and human services to bear on these kinds of issues. And heat is completely exemplary of this. Department of Health and Human Services, the biggest government department. It has many, many different components that range from the financial safety net of the things like the low-income home energy assistance program and the funding for Head Start, all the way over to the public health departments and support for public health departments at CDC, the research side at NIH, and the emergency response side in our Administration for Strategic Preparedness and Response. So what our office is doing is trying to take us through a transition where, especially with respect to heat, the focus of the federal government on heat has largely been to have good heat advisories, to have the National Weather Service put out a heat advisory, have it go out to everybody. But we've crossed this threshold now. The mortality from heat has gone always the highest of all natural disasters, but it's gone up threefold in the last 3 years. And I think we're seeing that we need to be thinking longer term and thinking in a different way about the response to heat at all levels of government. So not just responding through advisories, but responding through real people and real material, cooling centers, outreach to individuals, and also the longer term mitigation. I will talk more about this in a little bit, but our office also plays a role in coordinating across all of the federal agencies. The Department of Health and Human Services didn't receive any funding for climate change work under the Inflation Reduction Act, but many other agencies did. The EPA, NOAA received some funding, the Department of Interior, Department of Energy, et cetera. So we convene all the federal agencies through an interagency working group on heat to try to coordinate that longer term mitigation side as well as the quick response side.
Hello, thank you so much for the invitation to be part of this event and to be part of this panel. It is a great opportunity just to sit among these folks here and have a chance to speak today. I think to talk about the Chief Heat Officer role, I think we need to go back a little bit of how that role was developed. And to look at that, we need to look at a high-level view of our state's extreme heat preparedness plan and how that came to be. Looking back at summer 2023, it was the hottest ever recorded in Arizona. Temperatures have been rising on an annual basis, and we've seen an annual increase in deaths and also heat-related illness on that end. And due to this, Governor Hobbs issued an executive order, 2316, and I think that's burned in my memory at this point, and directing her administration to plan and prepare for future extreme heat events. We know that extreme heat is a complex disaster and that it impacts public health, the environment, has economic burden that comes with it, and then also impacts our quality of life across the board in our state. So this EO triggered multiple interagency resiliency forum workshops. It also triggered our first ever in the state of Arizona Health Heat Summit that we had in October of 2023, which gave an opportunity for experts, leaders, and those heat partners across the state to come together and put in what they thought should be done moving forward for future heat seasons. This was a great input that was then put together by our Governor's Office of Resiliency into that plan, and that was distributed on March 1st of this year. And looking at it, the plan covers a couple of different primary areas. It has a cross-agency preparedness for the 2024 heat season that has 4 primary priorities of shelter, energy, health, and disaster response. And also it takes a look at the longer term policy and operational needs for our state. And those include safe and affordable housing, adapting and updating our emergency response plans as needed as we move forward, looking at cooling center network improvements and support that are needed within our grassroots efforts that are happening across our state, and looking at data for action, improving our knowledge amongst our citizens, and also what can we do for workforce development within our state to make sure that we have the workforce that we need to accompany different items that may come forward, such as HVAC and other repairs on those ends. So the chief heat officer role was developed to oversee the implementation of Governor Hobbs' plan and to work and coordinate with private sector, community-based organizations, municipalities, other communities, private sector, and also community-based organizations. And the effort identified in the plan was required to sustain attention and collaboration across all these different jurisdictions, state agencies, and partners. So I hope to utilize my preparedness background and experience to look at ways to standardize processes, streamline communications, make sure to have an open mind and a listening ear to those partners across the state, and hopefully bring a centering presence before and during and after heat season. And I think that approach of collaboration and transparency hopefully will have better outcomes for 24 and beyond, and be able to leverage this new role as much as possible within our state. Thank you.
Good morning. Can you all hear me? No. What about now? No. Oh, no. Okay, great. Good morning. I'm gonna just kick us off with a test. This is a chart of daily deaths minus COVID deaths. So it's a daily death chart with the COVID pandemic sort of subtracted. And what do you think that spike is with the yellow circle on it? Yeah, heat wave. It's the 2021 heat dome, is what we call it. You know, we don't name our heat domes or heat events like we do hurricanes, but that was the 2021 heat dome. And that we weren't very prepared for that. And I think that's why you see such an extreme mortality response. We lost a lot of lives. The excess mortality during that week was about 1,200 people over what we would have expected during that time period. So like Dr. Balbus said, extreme heat is the more deadly natural disaster. And Washington State we haven't done a ton of, am I too loud? Do I need to be further away from this? We haven't done a ton of climate, heat resilience. A lot of our climate related resilience work is wildfire smoke, a lot of water related, snowpack related stuff. So this was really our first experience with a big extreme heat event, and it really kicked off some statewide initiatives to try and work on this. And the first thing that we did was in collaboration with our academic partners, and we wrote this report with our climate impacts group from the University of Washington and the Gonzaga Center for Climate Health and the Environment. It's called In the Hot Seat, Saving Lives from Extreme Heat in Washington State. And that's really our roadmap for what we think we need to do as a state to prevent, having this loss of life from the next heat wave. And we expect to have more as time goes on and as, climate change impacts intensify. And we also had a policy response. So we've done some labor and industries passed a heat rule to protect farm workers, and has sort of cut points at 80, 90, and 100 degrees that sort of, increasingly allow farm worker protections. And we've done a lot of collaboration. So that same group, I'm just going to tell a quick anecdote. That same group we worked with at the University of Washington, they sent us a academic paper that was like, here's all the things public health should do to protect people from extreme heat, plant trees, change building codes, and this whole list. And I was like, do you know that we don't do any of that? Like, we don't plant trees. We don't control building codes. Like, we are not the doers in those environments, and we can convene and we can work and we can do policy stuff. And so that really led to the focus of the report, which is that it's the interventions we need to do for extreme heat are inherently collaborative. You need, public health working together with, commerce and your planning agencies. You need to be working with your building code councils, and you need investments to make all these pieces work. So I'll leave it for there and pass it on to David.
Yeah, thanks, Fred, and appreciate the opportunity to be part of this panel representing the city of Phoenix here. And I think part of the reason cities are in this conversation is because cities are the doers of a lot of the processes you described, or at least that's what the research that Kelly's team at UCLA and others has been describing. In the introduction, Kelly described our national heat governance model as not sufficiently sophisticated or mature, and at the city of Phoenix, we are trying one model to improve that sophistication. We have a dedicated team, our Office of Heat Response and Mitigation, that directly reports to the city manager. We don't have the big budget for implementation. We don't have a big staff for implementation, which I think implies that we are meant to be a cross-department and cross-agency synthesizer, a catalyst, a thinker, an advisor, and that's the work we're trying to do. But we are absolutely still learning what the balance should be for a team like ours between programming, policy making, advising. Right now, at this very moment, we have one team member who is mapping out the supply chain to get water to our senior centers, and another who is synthesizing community feedback on trees and shade. So the playbook for how to do, I would say, all of our jobs up here is related to heat is, we are writing it right now together. The people in this room are writing that playbook. To answer your framing question, Kelly, why should our government agencies care about heat? At least three thoughts come to mind for me. One, it's something that our residents here care about. At our city budget hearings every year, we have a public budget hearing process. Heat and climate often show up near the top of the list in terms of what people are showing up to these meetings to talk about. This year, it happens to be water fountains at public parks. Second, we know it's a huge public health impact. Public health in the way that Rad described on the slide in terms of very severe outcomes, including mortality, but also everyday outcomes. I bet there are 10,000 or more people in the city of Phoenix right now today who are worried about when they're going to turn their air conditioner on. 95 degrees or so is the high forecast. Say that's public health as well. And also, to be a little bit provocative, following the lead of our moderator, I think the economic prosperity of our city, our state, and the Western states as a whole depends on how we handle heat and what the perception is, especially among the investment community, of how we're handling heat.
Great, thank you. And that's a nice segue. I don't think anyone in this room should feel maligned for the fact that heat governance is newer and emergent. But as we're crafting heat governance together in the future, there's certainly some unique challenges and opportunities. So I would love it if, starting maybe back the other way, Dave, and then come this way, if each of the panelists could speak to, what are the priorities in your agency, the priority areas, and then what are barriers that you've encountered, maybe specific stories to go with those barriers, and then also success stories.
Yeah, thanks. It's a great question. As I alluded to in my opening remarks, still writing the playbook on all of this. So I think we are all, I'm looking forward to hearing my colleagues on even our understanding how to articulate priorities. I think for our team, certainly protecting public health and improving quality of life are the priorities. And that it means we have to be in close collaboration, as my colleagues alluded to, with emergency management, with fire, with those other first responders who are out there, but also with the public works and the street transportation, those departments as well. You asked about tensions. And if we closely read the city of Phoenix mission and values, health is not explicit in there, in part because health is a matter of county jurisdiction here in Arizona. But I do wonder if there is a cultural shift that's needed to really center health alongside service delivery, alongside picking up the trash and repairing the potholes and citing people for blight violations, all the things that the city does and does pretty well. I think integrating health and recognizing that mortality in particular is a very severe outcome that we ought to be prioritizing in our efforts is work still to do. And this absolutely shows up as a tension. Folks here in Arizona may have seen news stories that we've had really insufficient availability of public cool space in the state, and certainly here in the Phoenix area, particularly after hours and overnight. And now we are addressing difficult questions about how do we use city facilities that might be providing other programming for other, for sensitive and special populations, seniors, children. Can we also use those facilities to meet the needs of some of the most vulnerable community members, which carry with them certain stigmas and perceptions among the general public? So that's a real tension that we are fighting right now. I think in terms of a success story, we've absolutely had the wins in our sails of the community, of city leadership to go forth and champion the heat cause, and whether it's new federal investment from the Inflation Reduction Act or the allocation of more than $8 million from a voter approved bond last year for heat specific projects. I think the resources are coming very quickly now, and we need to build up our workforce capacity to implement them.
And I'll echo that equity piece. So I think when we're talking about our priorities, we want to focus on the most vulnerable first. So when I showed you the mortality list, the people who died during that event were, those vulnerabilities were shaped by a number of things. Some of it is biological. So, the very old and the very young are more susceptible. And then there's also social vulnerability. So people who have access to cooling, people who have access to safe spaces, people who live in parts of the city where cooling is available. Those frame how we want to do it, target how we want to start our response. So where are we going to go? Who are we going to invest in first? And the reason in Washington State we have the opportunity to make infrastructure level investments is because of our Climate Commitment Act. So that's a tax and invest program that has created a lot of revenue that has gone into greenhouse gas emissions reduction programs, but also climate resilience programs. So because of that program, we have a number of investments that we're able to make in our office. So we have a Climate Plus grant that's making schools heat and wildfire smoke resilient. We have an occupational health proviso that's providing $10 million to provide supports for workers who are impacted by climate. And so those policy pieces are really important. So in integrating, the greenhouse gas reduction pieces and the climate resilience pieces are really important. So like if you're looking at an indoor environment and you want to keep it cool, but you also want to meet new energy efficiency standards, it takes a lot of coordination. But figuring out where you want to do that and how you want to approach, getting to those at highest risk first is important. And one of the things that I think that's on our growing edge is how do we build the community structures where you help people out? So heat waves, people don't die in exciting ways like they might in a hurricane. It's a slow, lonely death for a lot of people. And so how do you build the structures where people will go check on their neighbors? How do you build the structures where people know where the vulnerable people are in their neighborhood and can help them? And I think that's one of the challenges that posed by extreme heat events and imposed onto the public health system on how do we build connection. So.
I think for my end, there's a couple of pieces looking at priorities. Definitely one is plan implementation. It's definitely key as we move forward in the state of Arizona. Having a set guidance and with executive support and leadership is so important for our state and really helps drive our initiatives going forward. Also looking at preparation is key. I come from a preparedness background, and anything we can do to prepare ahead of time is definitely setting the stage for a successful summer. So I think doing that coordination, preparation, having open lines of communication, doing touch points, make sure everybody knows who are the players that are at the table and how to get in touch with each other is going to be really important as we move forward. Also looking at the establishment of heat thresholds as we move forward. I think one of the items that happened in 2023 is just kind of trying to figure out in some siloing of efforts and events as we move forward. And then what were the thresholds to hit certain triggers of awareness or to pull certain levers as we go forward for heat season and resources and other pieces that would be coming to the table in those requests. So I think really establishing heat thresholds and having that awareness across the state so everybody could be on the same page as we move forward, but not only establishing those thresholds, also looking at them as being a flexible approach, because we don't want to just be concrete and stiff with anything. We know that the way that we're handling heat and those impacts are going to change over time, and we need to have that flexibility to be able to do and implement best practices as we move forward and make changes as needed and not be stuck in what we put forward as the first go around and not being closed to having input and guidance as we kind of make some changes and look at that as we go from season to season. I think also looking at education and awareness across our state is going to be really important. Getting the messaging out as quickly as possible, making sure that we have several avenues of spreading that message across the state, working with local partners, other state agencies and others to help communicate that to their constituents and stakeholders is going to be important so that we can get everybody on the same page of what you can do for not only yourself, but your loved ones and your neighbors moving forward into heat season is going to be really important. A simple empathetic step like checking on your neighbor or checking on your loved ones is something that everyone can do to ensure safety across our state. And hopefully that is not that much of a burden to do that check-in during heat season and beyond. And that can be leveraged for other environmental and biological impacts that we can have in our state. I think there was a question about tensions going forward for heat season. one of the things I'm really worried about is complacency. If we look at our preliminary death data, we have 987 deaths for 2023 in our state of Arizona, and 44% of those happen among Arizona residents that lived in our state 20 years or more. So I think so often we hear that it's a dry heat. We always are hot in the state of Arizona. We have those populations that we definitely want to focus on within our state that are highly vulnerable to heat. But just being an Arizona resident puts you at risk for death in our state. And that's something that we need to get across to folks so that they can understand that this is you, your family, your grandmother, your mother, your children, your neighbor. Anybody can be at risk within our state, and we need to have that awareness. And just because you've always been an Arizona resident doesn't mean you're immune to heat as we go forward. I think for wins, we've had some really great wins so far within our state. We established a structure with work groups and also an Arizona Heat Network to get an incorporated group of anybody interested in heat efforts. They can be informed on efforts that are going on across our state. They can have input on direction and steps that we're taking within our state in regards to heat and help drive those initiatives. And we have a regular group of 75 individuals, and we're adding to that regularly to help inform our work groups as we go forward that are regularly engaged in those efforts and are providing input from everything from data to a cooling center organization and streamlining and guidance to communication and make sure we have multimodal approaches and multi-languages going out and making sure we're hitting those populations in an appropriate manner to various other topics that we're doing across our state. So it has been a huge win to see that engagement and also that drive amongst our HEAP partners. And I think also our state agencies and the way that they have been engaged moving forward with their input that they provided to our Governor's Office of Resiliency and Director Mahoney and also Governor Hobbs on what they can do and what they can prioritize for heat season for 24 and beyond. Their engagement in our interagency resiliency forum of a group of state agency leaders and decision makers and their attendance to that group is key as we move forward. And they have been engaged from that first calling in 2023 to date. And I think having that leadership, having that engagement across state agencies really puts us in a positive light and in a positive position as we move forward for heat efforts.
So from a federal perspective, I'd say one of our top priorities is echoing what has been said, reaching the hard to reach. To have an equity lens, that means we have to look at who is not being picked up by the existing system, who is experiencing the greatest burden, who is suffering the most. If you look at the epidemiology, dating back to Chicago in 1995, it's isolated elderly people, especially those with a lot of chronic conditions. It's also people who have existing behavioral health, mental health, substance abuse problems. If you look around the world at who ends up in emergency rooms, it's often people with mental illnesses, often because of the medications that they're on. And so, we have to look at what if you look at these groups, the isolated elderly, people with substance use issues, people with behavioral mental health issues, people with chronic medical conditions, one thing they have in common is that they are tied into our health system. And I would say that the health system up until now has not had a really strong focus on addressing the needs of people with heat. And, this is a kind of a broad theme across all climate change related issues. The climate change folks, don't think that the health sector has a really important role to play. And the health folks don't think that they have a whole really important role to play in climate change either. They think that climate change is an environmental health issue. And so we should deal with it from an environmental health perspective. But in fact, climate change is a fundamental health issue and fundamental to the social determinants of health. So as the Department of Health and Human Services has an equity plan and is really dealing with the social determinants of health, we need one of our priorities is tying in those things that overlap with what we need to do for heat. So the financial assistance, making sure the safety net health systems, the community health centers, the community behavioral health centers, the rural hospitals, the essential urban hospitals have providers who are trained up and are ready to be both dealing with people when they come in with heat stress, but also being able to give anticipatory guidance to people who are on medications that may put them at risk. So we're creating resources for this. Of course, we get our resources from Congress, And so we can only deal with the Congress, what we get through the appropriations. Often that means we're left with creating dashboards and new indices and guidance and websites, right? Because those are relatively cheap. And then the states and the locals end up having to make up the difference in terms of funded work. Another priority is getting the warnings right. And this is another theme that came up. We are moving from a feeling that there is a universal threshold that, 95 degrees, a heat index of 95, a heat index, that you can come up with one number fits all and work to that. And, the big success there is the rolling out this week of the heat risk, where we're not only customizing based on the climatology of a given region, but we're customizing it given the health experience of a given region. The heat risk uniquely looks at where mortality actually goes up related to heat for, I think, 230 different metropolitan regions and customizes it to that. The issue with complacency, and the thing that's really hard, and the reason why we have to have the health system engaged, is that, if you look at where the bulk of illness and death occurs from heat, it's not in the extreme heat events. I mean, the extreme heat events can cause those big spikes, but in a place like Arizona, there are people dying, at the 90th percentile and at the 85th percentile of temperature as well. And so, complacency can't be, well, we're going to make sure we really identify the worst and have big response. We have to be thinking about where the bulk of that morbidity and mortality occurs. And that a lot of that has to do with the health system. So we're working on policy advances. That includes Medicare and Medicaid waivers that Oregon was the initial state. I think Washington has an application in, so that physicians can prescribe air conditioners. We're looking, I know there's an issue in the Western states about the LIHEAP algorithms for determining funding. And, I can't say that we have an exact position on that, but we obviously feel that we need to be, balancing out the need for protection of people from extreme heat to the protection of people from cold. And in terms of barriers, it is an uphill battle, or, there is a little inertia to overcome in terms of getting all the mainstream health divisions of HHS to take on heat, to take on climate change as something that is fundamental to them, not something that another environmental health entity can do. But we've made great progress with that. We just released, and we're seeing that, in those very bureaucratic governmental things, whether that is the new strategic plan or our strategic plan supplement, where we have every single division of HHS represented in commitments to specific actions, whether it's the HHS strategic plan itself, which has a goal related to protecting people from climate change related health impacts, whether it's the public health emergency preparedness program, which just came out with a more agnostic all hazards approach that will put heat and extreme weather events on equal footing with anthrax and dirty bombs, which has not been the case for 20 years, whether it's the National Health Security Strategy, which now explicitly mentions climate change. So we're moving on all of those trappings, and now it's, as we're saying, now we're writing the playbook. Like, what does that mean to actually do that? And for that, we need this kind of collaborative conversation.
Great. Thank you so much. Oh, did you have a follow-up? Oh. At this point, we'd love to turn it out to the audience to see if we had any questions from you all for our panelists.
Thank you. Good morning. Diane Brown with the Arizona Public Interest Research Group, Arizona PIRG Education Fund. Really appreciate the work that Governor Hobbs, Mayor Gallego, Mayor Romero, other Arizona leaders have done to address the effects of extreme heat. And for those who haven't yet, I'd really encourage you to read Arizona's Extreme Heat Preparedness Plan. And big shout out to Director Mahoney and her team for helping to kind of lead the efforts. My question for the panel is, based on your experience, what policy or policies do you think need to be enacted or better enforced to help to reduce the number of individuals and families that are impacted by extreme heat in the first place?
Great. Thank you so much for your questions. So I'll turn it to the panel. Maybe you can talk a little bit about that mitigation piece and how you're addressing that.
You know, one of the challenges with mitigation is that the emergency responders mean like reducing harm, and the climate change people mean reducing greenhouse gas reduction. So we're talking about the reducing harm mitigation, just for clarity. I think Arizona provides a great example for Washington State in the way they've set up the leadership on extreme heat, because Washington, we have a patchwork of sort of organic, heat response activities, from like passionate people in our healthcare fields, in our public health fields, in our community design fields. And there isn't an overarching structure to organize those into like a stronger process. And I'll also say that, extreme heat we need to, in addressing it, need to be aware of siloing it and not intentionally not doing that. And I'll give an example from Washington State. During the heat dome, the week after the heat dome, there was a sort of one of those big low tide events and a massive shellfish die off. And our shellfish industry, even though they were following the rules, were harvesting shellfish that led to a Vibrio outbreak. And it was because the shellfish harvesting rules never thought that we would be, encountering 115-degree days in June, right? And so, like extreme heat needs to be incorporated into our rule development and our policy development broadly, and not just around extreme heat in particular. And it's same with like our infrastructure. And when you're thinking about what conditions are you designing buildings for, you need to be designing them for those future positions. So I think, having a leadership, having a clear leadership structure in the government, so that people know who to go to for support when they want to integrate extreme heat into their other policies, and they aren't experts themselves, they know where to go. That's something that I think is necessary and needs to be built. And it also can like braid those kind of grassroots efforts together and make them more coordinated and effective.
Sure, I'll take a stab at that one. I think from an Arizona viewpoint, really looking at the connection to economic and modernization policies that are out there, I think heat, as David mentioned, is impacting all of those pieces. And so we can see those impacts happening from tourism to real estate to individuals bringing in new businesses and developments on that end. So I think really tying policies and showing that you're moving forward with heat mitigation, heat efforts, you're taking on that problem head on, builds confidence to those economic partners that could be out there really taking note of some of those pieces that are at play within our state. I think looking at policies around worker protections is really important. And how can we protect individuals that are out in the field? We see heat-related illness and heat-related deaths really impact our vulnerable populations, but one of those are outdoor workers. And that could be everything from farm workers to, there was a talk about wildfires right before this. You have firefighters, police, construction workers, individuals of the Department of Transportation. There is a wide gamut of individuals that are impacted by heat, and making sure that we're having those workforce protections and looking at some of that so that we can have a sustainable and viable workforce moving forward within our state is really important on that end. And then I think just looking at the policy viewpoints, and as Rad said, it's just interweaved within everything, and having that awareness across the board. You can't pull out extreme heat or some of these climate impacts and just look at them in a silo. And I think for so long, efforts have been siloed. So one of the hopes for the extreme heat preparedness plan and for the chief heat officer role is kind of bringing all of those partners together so that we don't have that siloing going on. And also we can have an equitable look and approach for the state. We have some really great efforts that are happening within our urban communities. They are well far into heat preparation and doing some of those pieces at the table, but we can't lose sight of our rural communities and tribal communities that can be truly impacted too, and have their own caveats and variables that we need to pay attention to. We need to listen to those voices, those individual needs, and those individual items that may come to the table from those communities, and make sure that we have an equitable approach with our listening ear across the board for our state.
Diane, thanks for the good question. You always seem to have outstanding questions when we have the chance to interact. I think a part of the answer to your question that comes to mind for me is mapping out what the policy landscape is, and the efforts of the Luskin team at UCLA and others are so important, because I don't think we know comprehensively what the entire landscape is. If I could shed a little bit of light on some of your work, Kelly's team at UCLA was able to find what I would say was a relatively obscure or a niche a line or requirement about funding matches related to accessibility needs at playgrounds that turned out to be hugely consequential for the provision of shade at those playgrounds. And I think it's really digging deep and understanding what that complex web is that's so important, and work we all need to be doing together. As you asked your question, I was also thinking about sort of capital P policy versus lowercase p policy, or even our position or stance. In the city of Phoenix, over half of our heat-related deaths are among people experiencing homelessness, and 90% of those have some indication of substance use. So if our goal is to move the numbers the fastest downwards, that's where we have to start. So is it our lowercase p or capital P policy that we are first providing heat relief supplies to harm reduction and overdose prevention organizations? Not yet, but it probably should be. Is it our capital P policy that every person who's in a cooling center interacting with that population has gone through special training? Yes, almost. We're pretty close there, but I think it's those types of questions we need to keep asking. The most concrete one that came to mind, which is I feel a little bit removed from the heat deaths conversation. You asked about enforcement. In the city of Phoenix, anyway, we have pretty good rules on the books about tree enforcement. If you cut a tree down or let your tree sort of get away from good health, pretty good laws, pretty good rules on the books, but enforcement is really weak. It's entirely complaint-based right now. And I think we can be much more proactive as a city, and we're working with the key departments to do so.
So from a federal perspective, that could be a whole panel all by itself. I'm just going to point to four things. At first, from the very top, we are in a bit of a challenge in terms of an overarching federal response policy. We have the Stafford Act, which is for natural disasters, but that was not designed for heat and is, not well applied. Although we're trying to figure out ways to adapt that. The law that governs the declaration of a public health emergency was not designed for heat. So, I think that there is a huge gap there that we need to figure out how to close. And I'm not going to sit on this panel and say what that looks like. But, I think that this ongoing dialogue of, what is the menu of responses that states and localities would need federal support for, and then being able to unleash, to loosen the funding for that, is kind of one key policy gap. The second big gap, I think, has been successfully closed temporarily, which is within the federal government. There really was not a program that was providing substantial support to communities for long-term heat mitigation. And I'll say with the bipartisan infrastructure law and with the Inflation Reduction Act, these are completely game-changing, completely unprecedented, and really pretty impressively closing what was just a yawning gap. So I think we should, it's not all doom and gloom. It's not we're not knowing what we're doing. That was a huge achievement by Congress a couple of years ago. The third area, and this could end up being one of the biggest challenges and the biggest policy frontiers, is that outside of Phoenix, if you look at the location where most people die in heat, it's usually in their home or in an indoor space. And there are a number of policies that are being floated about, and in many cases, they are dying in spaces that they don't own. And so somebody else owns the space where these people are dying in. And so the whole issue of policies for landlords, of policies for indoor spaces, of policies for public housing, and determining, how that gets set up, what are those thresholds, how that to me is I think one of the biggest challenges that we have to figure out how to close. It's going to need a lot of innovation, a lot of creativity, a lot of piloting at the hyper-local level, because that's where a lot of these things are determined and kind of bubble up and down. And then the last thing I'll say is in terms of enforcement, the biggest issue of, or one of the biggest issues of enforcement is the enforcement of our existing occupational safety laws. The issue with workers right now, we do not have a heat standard in place. There is a heat standard going through the OSHA process, which is a minimum 7-year process. But since its inception, OSHA has used to its advantage the general duty clause, which says if there is a known hazard and if there's anything that meets the definition of a known hazard, it's heat, that the employer has a general duty to protect workers from it. And OSHA is responded to the heat crisis by really ramping up and having special enforcement programs in the last couple of years that have been. I'm still waiting in my interagency hat to hear like a report on all of the outcomes. But when I've gotten interim reports, they're ramping up that activity and helping workers in a lot of these outdoor workspaces. So I think that's a big enforcement gap, that could be applied now to help people.
Great. Thank you so much. And the only thing I might add is the programs like BRIC or BRACE, it can be very onerous for states to meet the criteria and thresholds without appropriate cost benefit metrics to access funds that might already be available. Do we have any other questions from the audience? Okay, well, maybe then I will dovetail into talking about economic impacts. So, extreme heat doesn't cause the damage that a hurricane or a tornado might, but it does have economic impacts, both in terms of events and sort of slower rolling impacts. I'll give a relatively niche one. We know that learning outcomes are deteriorated at schools when it is too hot for children to learn. And that might have long-term implications for our education and our workforce. So I would love for our panelists to comment on some of the economic impacts of extreme heat, and maybe going back to what David said about the economic prosperity of states in the future is going to be tied to heat.
I'm happy to start, Kelly, since you threw the baton to me. Yeah, I think that there have been we're seeing an increasing number of studies that are trying to count the dollars related to heat, whether it's estimates of lost worker productivity. We, of course, can cost out 911 calls, hospitalizations. There are federal tools to value lives saved as well that we're factoring into the cost benefit analyses. But maybe I'll start by just contemplating with the group the headline cost. It is our understanding that a very small water complication in Arizona last year turned into big international headlines that Phoenix was out of water. And we are not out of water in Phoenix, and we are excellent at water planning in Phoenix. But the amplification of this particular news story that really had nothing to do with the city of Phoenix, we understand cost the city at least one major real estate deal. So the perception of what was happening with an environmental hazard cost us economic development. And it is not hard to imagine at some point the continued accumulation of people are dying from heat in Phoenix, people are dying from heat in Arizona, people are dying from heat in the West. If that filters into the minds of some of the people who we're approaching to bring the world's leading technological industries to Arizona right now, if that influences their thinking in an adverse way, it could be really detrimental. So I think we need to approach this from a public health standpoint first and foremost, because it is the right thing to do to try to save lives and keep people out of the hospital. But I think there are a lot of economic incentives that we could align as well to support this work, particularly as we head off of a funding cliff that Eugene may talk about, particularly as we head off a funding cliff to ensure that our states and cities continue to thrive and grow as we all envision they might.
Yeah, and I'll just add briefly that I've always wanted, like on my bucket list is to hire an economist to be on my EPI team, because that That's the piece that sells policy, right? So we talked to a local climate action planner in Thurston County in Washington State, and we were talking to them about, what could we provide? Like, what are the things that you need? And she said, well, we've got this climate action plan and we're going to bring it in front of the county commission. And they're going to say, well, that's great. How much does it cost? And we're going to say any amount. And then they're going to say that's too much. And then it's not going to get implemented. And so we need to help them describe the benefits of climate resilience because they are real, there's a lot of debate about like value of a statistical life and how that happens. But, just the infrastructure impacts, in Washington State during the heat dome, there was a massive shellfish die-off. And that was a huge hit to our shellfish community. So much so that we don't even have great mental health, surveillance systems, but we were seeing that there was huge mental health impacts in those just in the communities that worked in those shellfish industries because of how terrible that impact was on their economy in that space. So I think that economic piece needs to be tied with the health piece so that we can make the case for the best response we can.
I think from my perspective, there's several economic considerations that you have to look at. We talked a little bit about the worker protections and those pieces. And I think we're seeing initiatives happen with our partners at ADOSH and others with their voluntary and complaint-based programs that they're moving forward to help educate on heat stress and other pieces going on there. But we can also look at the economic impact of emergency department costs due to heat-related illness that were 6 times higher in 2022 than 2008. And looking at hospitalizations were 8 times higher during the same time frame. And those numbers vary from 11 million in 2008 up to 87 million in 2022, and that economic burden that it has upon our state. And not only those economic burdens with the healthcare costs, but also lost work, lost productivity, lost connection to family and loved ones. And that's rippling effect across our state that we can see going on. So, heat will have those impacts. And looking forward, as David mentioned too, on sustainable funding for heat infrastructure and efforts as we go forward. I think as we look at 2024, luckily we have some funding mechanisms that our local municipalities and counties and others are able to lean on, such as American Rescue Plan funding, and be able to do a hodgepodge approach to cover infrastructure and costs at this end. But I think we're really looking at a funding cliff for 2025, and we need to look forward to see how we're going to have sustainability to be able to fund that infrastructure going forward in years in the future. And that is a big part of some of the work being done within our work groups to identify some of those funding sources and to see what we can do to make sure that we ensure funding and support going forward. Because if you can't fund that, there's only so much that philanthropy and other efforts can really cover on that end. And so we really need to take a look at that and what we can do moving forward. And I think showing the economic picture, the return on investment is really important for how much a dollar we put into prevention and preparedness. What is that going to save us in the end of heat season when we roll out in October? And I think that's going to be an important case to make as we go forward.
And if I might just piggyback, I think we're also learning how to talk about how much these efforts cost right now. I don't think that's been something we've really understood in the past. When we had a cooling center evaluation a number of years ago, most of the people who operated cooling centers said, we don't think it costs that much. We just fit it into our operations. And I think that was because we weren't really putting any effort into it. Thanks to our Arizona Faith Network and some of their facilities, they can provide you the cost estimate of what it takes to run a cooling center the right way from their model this year that we can then build up and factor into these cost benefit analyses. I think costing out the benefits and the costs are both areas where we have work to do.
Yeah, and we can proxy that going forward across our state, because if we're standardizing cooling center efforts and the way that they're working those modalities and having a standardized structure for our state so that we understand the capacities and the infrastructures that are there, we can use that as a proxy to make some gauges if we increase or decrease those cooling center and what those impacts would be in the community. So I think we could leverage that as a case going forward.
Just to put a larger perspective on it, there's a really strong body of literature that looks at the loss of labor productivity associated with heat. And every year, the Lancet Countdown, if you're familiar with the Lancet Countdown, does an estimate of the lost labor productivity for the year before. It's one of their health indicators. For 2023, they estimated that there were almost 3 billion hours, 2.9 billion hours of labor productivity lost in the United States in just 2023 alone. The Atlantic Council and the Arch Rock Foundation did a big report on this in 2021. They did an analysis for the whole country. They estimated about $100 billion of lost gross value added from heat alone. And they did this actually, it's an interesting study. If you haven't seen it, I think this crowd would really be interested because they analyzed it on a county by county basis and estimated the lost productivity of every county. And if you look at the map, it's very interesting. It will look like, it looks like the regional forecast for heat from the beginning of the summer of 2023. It's Texas is mostly Texas, and then a kind of a stripe up the middle of the country to the Dakotas. Arizona, not quite as intense, I think, just because your industry is maybe a little bit more acclimated. So, and the last thing is a study just came out, I think, 2 weeks ago or so in Nature that was looking at not heat alone, but climate change and its impact on GDP in 2050, I think. And it was very sobering. It said that we've already experienced about a 10-15% loss of GDP compared to where we would be from climate change that has occurred so far. This is globally. And they compared, I think, a 2-degree increase scenario from a 4-degree increase scenario. And showed that a 4-degree increase scenario, would be a 30 to 40% global decrease in GDP, and that the cost to actually do the policies and implement the policies to keep the temperature at 2 degrees were about a sixth of that. It was about a 6-to-1 ratio of investment to lost economics. These arguments have been around for a really long time. I haven't seen them stick. But the economic arguments in terms of lost productivity, which is a very inhuman way of thinking about it, because the reason productivity is lost is because people physiologically can't do what they're supposed to do, which goes with incredible suffering on their part as individuals. I think we have to acknowledge that these are lost productivity means harmed individuals, either from loss of wages if they're protected or from suffering because they can't do what they're supposed to do physically. It's enormous. It is very enormous, and we don't think about it enough.
And John, if I might just piggyback, I love this humanization of the concept of lost productivity, harm for those individuals and harm for the individuals who benefit from the work as well. I think one of the most interesting papers I saw in the last 10 years, one of the tasks which wouldn't even seem to be that stressful from a heat perspective that is done worse when it's hot is food safety inspection. And when are food safety inspections most likely to yield problems? When it is hot. So even our food safety inspectors, which impacts how we are all doing every single day, even there, the lost productivity is really translating into experience for all of us.
Great, thank you. Well, we have 5 minutes to wrap up this conversation, and we could talk much longer. This panel has been talking all morning, and we'd love to continue the conversation with you all. If I will, I'll just make a plug for the approach that I think David alluded to that we're using at the Luskin Center, which we call the heat exposure settings approach. And that's where we start with the settings where people who are vulnerable to heat might be exposed to it and do a whole of government audit of all the policies, not just heat and climate policies, but the really small nuanced policies. So the one that David was referencing is a federal requirement for ADA compliance matches to install a shade structure in schools. California had a law doubling that to 40%. We were able to roll that back to 20%. It was a no-cost piece of legislation and an easy win. Another easy win is the use of things like wet bulb temperature globe sensors to determine safe play at schools. So I would encourage you to look at the low-hanging fruit that is out there that the state can tweak in sector by sector legislation. And so with that, I want to turn it over to the panel and ask you to very quickly say a 1-minute closing observation or key takeaway message.
The one thing I want to close on is, I think we've imparted that there's good things going on, but we are kind of writing the book as we go along. It's true in the federal government as well. And the quality of the book we write is really going to be dependent on what we hear from the states and localities. So I just want to encourage everybody in this room, all of the state offices, all of the county and city offices, to be in touch with us, to reach out You can reach out to me in my office because of the role that I play in connecting, or to any of the other offices, the NIHIS office, the FEMA office, but just to share what your experiences is, what we're not providing, what are the gaps in what the federal government is providing to you to do the job. As you discover what those gaps are, in more concrete and specific details as well. I think that's how we're all going to get through this together.
I think in closing, I'd just like to say, when we're talking about heat, illness, and deaths, it's a very dire topic. But I'd like to step away and say that I am very encouraged for the state of Arizona. I think as we look at investment from a federal level with the recent dropping of the heat risk tools and also FEMA's development of a climate adaptation planning being sent out, we know that there's federal support. From a state perspective, with seeing our development of an extreme heat preparedness plan, our next steps that we've done to do engagement across our state, and also the participation that we've seen in our state is very encouraging. And then to know that on a local level, efforts have been working and spinning up for over a decade, and we're looking at ways to improve that, share best practices, and have a unified approach across our state. Just leaves me encouraged as we go forward that we can come out better at the end of our annual heat season each year and learn from each one that we go through together and be able to have better plans and implementation as we go forward.
Thanks. Climate resilience, is going to touch so many sectors. Housing needs to be climate resilient, transportation needs to be climate resilient, city design, government. And when we're looking at things that are going to impact all these different ways, we have a chance to have an impact that can last a long time. And an example I used is redlining. So if you look at redlined areas compared to non-redlined areas, even though it's been off the books, it's been an illegal policy for 60 years, your chance of dying from an extreme heat event in a previously redlined area is double that of somebody who doesn't live in one of those areas. And that's just a mortgage policy from 60 years ago, right? So these choices we are making now are going to leave a legacy for our kids and our grandkids in the policy environments they inherit, and let's make a just one.
Thanks, Kelly, for moderating, and again, for everyone coming. Just to build on what Rad said, I think we need a lot of creative thinking, energy, and investment to resolve the historical burdens that we've been left with in terms of city implementation. This means that the places that we'd probably all think are most in need of trees and shade are the most expensive and most complicated to institute those projects. So the equity framing is really important, and actually mapping out how to do it is really important. I certainly share Eugene's optimism. The fact that we're having this dialogue is really important. I would invite everyone to scan their calendars and think of other meetings where heat and climate resilience can be added to the dialogue. And as we do so, I hope you'll see more local successes. To be a Phoenix ambassador and part of the host city here, I'd invite everyone to take a walk when you have a break, whether it's around the ASU downtown campus here or a couple blocks to the south on Adams Street, some of the best shade in the city that I think shows what's possible when we are able to line up the resources correctly. And it's replicating that model to the communities that have been left behind for 5, 6, 7 decades or more. That is the work ahead of all of us. Thank you.
Thank you so much. Thank you so much for our panel for being here. And I think I'm standing between you all in a break. Yeah.